Earlier in the show, we talked about a new filler that causes potentially less swelling and inflammation. We put it to the test. We're back with Dr. Rivkin and Sheri to reveal the results. We're gonna look really quickly at Sheri before at the beginning of the show. And let's see Sheri now.
Wow.
Total difference, yay! Thank you.
Sheri, clearly, you hadn't seen that until now, had you?
I have not.
I think the biggest change that we saw you start on the nasolabial line, I think that's where you see the biggest change, because that was a pretty deep, conspicuous nasolabial fold.
Yeah.
So do you want the non-beauty person here to take some guesses?
Sure.
Yeah, take a stab at it.
All right, so maybe I'm seeing some in the chin area?
Yep, that's correct.
And then how did you get, it seems like there's a lift in the eye area.
Travis, you're right on. So what I did is we injected underneath the eye into the tear trough area to just smooth that out so that there's no shadow that's falling in here, so she doesn't have dark circles under her eyes. She doesn't look tired. In conjunction with that, a little bit of filler into the cheek area, into the upper cheek area. When you inject into that area, that lifts the whole face. And people think that it lifts the face physically, that it drags tissue up. I think that's a minor effect. I think the major effect is that it's an optical illusion, because when your eyes are framed nicely, a person who's young has nicely framed eyes with their cheeks. When you recreate that framing, the focus of her face is now back up to her eyes. When her eyes aren't as framed, the focus of her face drops down to the lower face. So the illusion is that her face is lifted. So that was, and again, not that much filler, but a little bit goes a long way.
Dr. Rivkin, how many syringes of filler did you use? And could you give our audience a sense of how much that might cost if they were to seek this out?
Sure. So we used 5 syringes of filler and about $3,000 to $4,000 about.
But because 5 cc's is
5 cc's is a lot of
pretty
filler.
good volume.
But the interesting thing is when you talk about how long something lasts, I've seen patients 7 years later and they're still great. So the eye area is particularly nice.
Well, I know one thing, Sheri, you seem to be very happy with the result. Your results. Thank you so much.
And I think it was a really lovely, rejuvenative, rewound result. It looks really natural, so well done.
Thank you very much.
Thanks to both of you.